Hello everyone. Today, we're diving into the world of a medication called Galantamine, commonly known by its brand names, Razadyne, Razadyne ER, and Reminyl. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Galantamine is an oral medication that falls under the category of cholinesterase inhibitors. Its primary function is to increase the levels of acetylcholine, a neurotransmitter involved in memory and learning, by inhibiting its breakdown in the brain. Initially approved by the FDA in 2001, it's primarily prescribed for the treatment of mild to moderate Alzheimer's disease. It helps improve cognitive function, memory, and the ability to perform daily activities in individuals with Alzheimer's. Although it does not cure Alzheimer's disease, it can provide symptomatic relief and slow the progression of symptoms in some patients. Warnings: Galantamine comes with its set of precautions. It is not intended for use in individuals with severe liver or kidney impairment due to potential risks and reduced effectiveness. Patients with a history of certain heart conditions, such as bradycardia, slow heart rate, or those with a risk of gastrointestinal ulcers or bleeding should use Galantamine with caution. Additionally, those with severe asthma or obstructive pulmonary disease should consult their healthcare provider before starting this medication. Before taking this medicine. Before starting Galantamine, several factors need consideration. It's essential to inform your healthcare provider if you're allergic to the drug. Given its impact on various body systems, those with liver or kidney diseases, heart problems, gastrointestinal issues, seizures, or respiratory conditions should discuss potential risks and benefits with their doctor. If you're pregnant, planning a pregnancy, or breastfeeding, it's crucial to consult with your healthcare provider. Regular monitoring by a healthcare professional is recommended to assess the effectiveness and safety of the medication. You should not take Galantamine if you have severe liver or kidney disease. It's also important to inform your doctor if you have ever had heart problems, liver problems, gastrointestinal bleeding or ulcers, seizures, breathing problems, or if you are on a low-sodium, salt diet. If you are scheduled for surgery, inform your doctor as you might need to stop taking Galantamine temporarily. Side effects: all medications can have side effects, and Galantamine is no exception. Common side effects include nausea, vomiting, diarrhea, loss of appetite, weight loss, dizziness, and headache. Some individuals might experience more severe side effects such as fainting, slow or irregular heartbeat, severe abdominal pain, black or bloody stools, or signs of gastrointestinal bleeding. It's essential to be aware of these potential side effects and consult your doctor if you experience any unusual symptoms. Additionally, there's a risk of serious skin reactions, including Stevens-Johnson syndrome and acute generalized exanthematous pustulosis, AGEP, which require immediate medical attention. Symptoms of these reactions include skin rash, blistering, peeling, or painful sores. Galantamine may also increase the risk of seizures in patients with a history of epilepsy or other seizure disorders. It's crucial to report any new or worsening symptoms to your healthcare provider promptly. Interactions: Galantamine can interact with other medications. It's important to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. Medications that affect heart rhythm, other cholinesterase inhibitors, anticholinergic drugs, and certain antidepressants can interact with Galantamine. Dosage: correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking Galantamine. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. The recommended starting dose of Galantamine for most adults with Alzheimer's disease is 4 mg twice daily, with or without food. This dose may be gradually increased based on tolerance and response, up to a maximum dose of 12 mg twice daily. For the extended-release formulation, the starting dose is typically 8 mg once daily, which may be increased to a maximum of 24 mg once daily. It's important to follow your healthcare provider's instructions and not to alter your dosage without consulting them. Avoid: while taking Galantamine, it's advisable to stay hydrated and to avoid alcohol, as it can exacerbate certain side effects such as dizziness and gastrointestinal issues. Given the potential for dizziness, it's wise to rise slowly from sitting or lying positions. Patients should also avoid over-the-counter medications that contain anticholinergic agents, as they can reduce the effectiveness of Galantamine. FAQ: Many wonder about the age restrictions for Galantamine. Currently, its safety and effectiveness in individuals younger than 18 are not well established. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of galantamine. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.